So here's a case example. So this is a 52-year-old female. She's had multiple failed rotator cuff repairs, was referred to me. As you can see, has advanced atrophy and fatty infiltration of the posterior superior cuff and no significant arthritis. So we're going to talk about the key steps of this procedure and how to avoid complications at each step of the way. So we'll start by talking about patient positioning, and then we'll move on to the part that probably gives people the most angst when they're starting out doing this, which is the actual harvest of the graft. We'll then talk about the Achilles graft selection and preparation. We'll talk about arthroscopic preparation of the shoulder. That way you can facilitate graft passage and eventually fixate it on the tuberosity. And then lastly, we'll talk about adhering the lower trapezius to your Achilles. So starting with patient positioning, this is really key. So in the beach chair position, you have the patient all the way over to the side of the table. The key here is you really want to be able to feel the medial border of their scapula. You want to make sure that this doesn't impede your ability to get a good graft harvest. Because the patient is all the way over to the side of the table, you really want to pay attention to their contralateral side and make sure it's well padded. Next, we'll talk about lower trapezius harvest, and like I said, this is the thing that probably gives most people angst early on because you're not used to looking at the back. So the first step in this actually is to take the arm and bring it into a more forward flex position. This will make the medial border of the scapula more easily palpable. So you'll be able to palpate the medial border of the scapula. I'll then palpate the scapular spine and mark the position where they meet. This is two sides of a triangle. Then you can just carry this over laterally to mark the acromion like you would do for any other scope. Your lower trapezius crosses at roughly a 45-degree angle right over here, and then your incision is right below it, and you want to make sure you're medial enough. So now, even in very skinny patients, they do have this amount of subcutaneous fat, which is important to go through. Next, in your mind, I want you to break this into quadrants. And if you start in the inferolateral quadrant, you're completely safe.